After the initial admission notes, we have a daily progress notes which has to be written once or twice as per the unit policy. In our unit, in the critical babies, we do it at least twice a day. Of course, there is always an additional progress note when there are changes in the condition, and procedure notes when we do procedures. A parental update note is always added when there is a significant parental update. I would suggest a parental update note at least once in 2-3 days in any NICU baby, so there is clear documentation that they are always updated. So we usually follow the SBAR approach. SBAR is an acronym for situation, background, assessment, and recommendation. It's just a systematic way to go through what needs to be documented, and it can facilitate prompt and appropriate communication without missing out any aspects. So we give a brief overview of the existing problems or problem list, which covers the situation part and the background part. The situation for a progress note, it's already set up. I mean, you know the baby, you're documenting the age, the current weight, and everything will be written, and the background includes a problem list. A short summary of the recent events, especially the previous day, and the review of current results, system-wise summary of the previous day's course. Your examination findings would come here, and all these form part of the assessment. So the plan would be recommendation, and the parental update, as I mentioned, would be documented as well.